It's almost nearly 4 years ago. I had a routine mammography and I was asked to wait because the radiologist wanted to talk to me. And as I was sitting in the waiting room, I said to myself, Karen, I think you're in trouble.
First of all, what went through my head was, I want to see my grandkids grow up. That's the first thing that goes through your head. You think, well, I had a pretty good life and everything, but the fear of cancer is out there, and when you get the diagnosis, you can't think straight.
You feel very numb. It's obviously a shock. I wasn't expecting to hear that.
I was very scared, very surprised. I didn't know exactly what that meant. And I think that's a problem for a lot of women because it's a big surprise, and at that time you're not really thinking right. You're just thinking, oh my God.
After the doctor said malignant, I didn't hear anything else because she kept talking. But then, she said, Miss Carroll, you have malignant cells, and I was just devastated.
I did not want to die of cancer, so I was willing to do anything possible so that my chances were the best that they could be to beat this.
I think cancer research, everyone who does it is really hoping for better treatments. I think many of us have family and friends who've had cancer, and what we're hoping to do is have something more effective and maybe less toxic or aggressive than the current therapies.
Researchers at the University of Pennsylvania Health System have come up with a new approach to treat cancer. By using your own immune system, they create a vaccine that can kill cancer cells and keep them from coming back.
Early breast cancer starts with cancer cells in the ducts, and it's something called Ductal Carcinoma In Situ. And they come in all different forms and varieties. One particular type expresses this protein called HER2/neu. It's a normal protein in your body that normally should not be on in your breast cells, but in the case of this particular cancer, gets overexpressed. So it means that too much of it's being produced and it's causing the cancer to begin.
If you're HER2/neu overexpressing, you're more likely to have invasive disease. The disease is more likely to spread, become metastatic, and it has a tendency to be resistant to certain frontline chemotherapies.
Patients need treatment for ductal carcinoma in situ, and the treatment options are a lumpectomy, take the area out that's bad, and potentially give radiation therapy afterwards, versus a mastectomy or a mastectomy with reconstruction.
You're really not afraid as much about cancer as you are about the treatment that you're going to get.
I had prepared myself to hear chemo. Thought, Karen, you need to really steel yourself, buck yourself up. You're probably going to go through the worst.
That was very traumatic as a woman to lose all your hair. My husband actually, when it started falling out in clumps, and didn't want to continue to have that happen, so my husband helped me shave my head. And when he said I do, I'm sure he didn't think that that's what he was going to need to do.
And when I read the statistics about traditional treatment, in a large percentage of cases, even though women suffer through all of the treatments, their breast cancer still comes back.
I thought I was free and clear. I had my lumpectomies, I had my sentinel node biopsy that came back totally negative and clear, and I had my radiation, and I thought, okay, we just monitor with MRI and mammogram, and I'm just good to go. And then it came back.
Clearly, there are many patients in whom microscopic disease has spread prior to the time the surgeon takes the tumor out. And then in months or years later, that disease comes back somewhere else in their body. And I think that's where vaccine strategies offer so much excitement, that if we can simply eliminate those last few stray cells that have gotten away from the main tumor and remove the main tumor mass, we will cure many more patients.
When you look back in history, all the big diseases were taken care of by the immune system and by vaccinations against it.
In this clinical trial, what we do is we give a vaccine made from the patient's own white blood cells that we activate out of their body with some components that tell the immune system this protein is bad, like a virus or like a bacteria, and then that will direct your immune system to go attack the cancer cells.
The main function of the body's immune system is to eliminate infection. And what this vaccine actually does is it tricks the immune system into responding against cancer with the same vigor and intensity that it normally responds to infections.
Your white blood cells are what fight other diseases and infections in your body, so why not use white blood cells in a vaccine to fight cancer and kill off the cancer? I mean, it made perfect sense to me. It was a no-brainer.
You're not putting any foreign chemicals in your body. You're using your own body cells, your blood, to fight the disease.
There can't be anything more pure than that, with your own body curing yourself.
This treatment I felt would be like a surveillance system that would be on 24/7, looking for these type of cells anywhere they might grow in my breast.
The side effects of vaccination are very minimal. It's generally, you have flu-like symptoms for a few hours after vaccination, headache, fever, and this sort of thing. When you compare it to what you go through with chemotherapy or radiation therapy, it's really much less.
Your hair doesn't fall out, you don't look sick, you don't feel sick. In between all of this going on, I had weddings to go to that was going on, and I didn't miss a thing. I didn't have to leave the party to have this done.
It's so much less invasive. I mean, getting a shot over getting surgery, I mean, 6 shots over 6 weeks is not a big deal for a cancer patient.
The side effects were I had a really small little red spot on the area of injection, but I felt completely well. I had very little side effects. I felt great. I had very favorable side effects, as a matter of fact. My hair grew, my skin got better.
Once you get the vaccine, you have still all the other options. You can, if you're really scared, have everything, you know. Let them do whatever treatment they have, because it has a chance to work better.
I had the traditional treatment. It failed. I have the vaccine. I get blood work every 6 months to see whether or not the antibodies are still there. They are still there, which means that they are fighting the HER2 that was in my body, and I'm cancer-free.
The vaccine had completely eaten up all residual parts of my tumor, and that when I asked him what my margins were, he said I had no margins, I only had normal tissue there.
I'm cancer-free, been cancer-free, normal mammograms, and I'm not fearful like I used to be.
We all look great, we feel great, we're doing well, and we're very confident about the success of this vaccine.
I'm not one of the lucky ones yet. I'm lucky because I know about it. But they're working feverishly on a peptide that helps for ER positive, that helps for triple negative, which there's nothing there right now. And he said that probably within a year I'll be able to get my vaccine. Then I'm going to be one of the lucky ones.
It's my hope to get the vaccine in the fall. It's all about time and money. The trial needs to be expanded, which takes money, and then also for me, the time for my immune system to get back to normal levels.
As investigators, we're always looking for novel ways to get the funds to do the work that we need to do.
We could enroll many more patients in clinical trials of vaccines than we currently do, and that our major limitation is funding.
If we continue to move along at the pace we're moving now, it may take 30 years to get through all these different trials to get it to the point of FDA. If we had instant funding at this point, we could probably move it into a 5 to 10 year window to get this approved.
Conventional healthcare insurance does not pay for research. So a patient who's getting a breast cancer vaccine cannot have their insurance pay for that vaccine until that becomes a standard treatment. So as long as that's a clinical trial, a treatment in evolution, it has to be paid for by research funds. And again, that's where I think Pennies in Action offers such an opportunity to accelerate the process of the clinical trials.
Pennies in Action is an organization that was founded in 2007 to support research in finding a cure for cancer.
All the money that Pennies in Action raises goes directly to the research.
We're all volunteer. There's no salary personnel.
Some organizations 30% of what you give will be swallowed up with administrative fees. That does not happen with Pennies in Action. Your money goes exactly where you want it to go.
Last year, because of our fundraising efforts, 5 more women were able to get the vaccine.
We need people to find it in their hearts to give because you are maybe helping yourself in the future, or you may be helping a loved one in the future.
It is entirely conceivable in the next 20 or 30 years that you might be able to be born with knowing what your profile is for what particular type of cancer you are able to get, and you could develop a preventive vaccine for that particular cancer.
It's going to have the same impact in preventing or fighting cancer that the polio vaccine did for polio.
It's only the money that stands in the way. The technology is there, but we are not putting the money in the right place. But how are we going to tell our children, you know, we could have saved your mommy, but it just wasn't important enough to put the money there.
Lives are at stake here. Time is of the essence. We need to get this moved forward so patients like me and many others can get treated.
I feel so lucky that I've had this vaccine developed by Dr. Czerniecki, and I hope that my daughter and my granddaughter don't have to worry about being lucky or unlucky.
What made me really want to do this is because, you know, there are lots of people suffering with this breast cancer, and I thought it's a really good cause, and I don't want someone I love or me have to go through it.
It's time for all of us to step up and offer our support. Let's not lose another life. Donations can be made at penniesinaction.org, at any TD Bank, by mailing a check to the address on the screen, or simply dropping change in any Pennies in Action jar at various locations. Please visit penniesinaction.org for more information on how you can help.